Vaccines. That's going to be the first thing that usually is in all the rules. In order for your dog to attend this group play area or session, you have to have whatever vaccines they decide is going to be mandated. If your pet has a positive titer, then you could take that to the group play situation, boarding, grooming, whatever it is, and say, well, look, I have a titer that says he's got antibodies to this, he's protected, we don't have anything to worry about. Another way we can get around having to give the vaccines is to give something called Nosodes. Nosodes are basically homeopathic remedies. The following ad is brought to you by Raised Right. I'm excited to tell you about Raised Right. They're a family-owned, human-grade pet food company that makes gently cooked whole food recipes for dogs and cats. I feel good recommending Raised Right because most of their recipes have less than 2% carbs, and their recipes are so simple. Many have just 10 ingredients or less. They were able to formulate their adult dog recipes to be complete and balanced using only whole foods without any synthetic vitamins or minerals. Raised Right has also teamed up with both Dr. Karen Becker and Dr. Barbara Royal to create a new line of veterinary support recipes to help with specific health issues. They formulated low phosphorus recipes for kidney support and low fat recipes for pancreatic support. My own dogs and cats absolutely love Raised Right. Order yours today at raisedrightpets.com/Dr. Judy. Once again, that's raisedrightpets.com/Dr. Judy. If you have a dog that you like to take to group play situations, whether that's at daycare, boarding, or a dog park, you're probably being told you have to have a laundry list of vaccines and chemicals given to your dog in order to attend. However, there are other options. And so I want to run through some of the different things that you might want to keep in mind if you want to take your dog for group play and you're being told that you have to do all these things. Vaccines. That's going to be the first thing that usually is in all the rules. In order for your dog to attend this group play area or session, you have to have whatever vaccines they decide is going to be mandated. Unfortunately, people who own dog parks and doggy daycares are usually not veterinarians, and usually they're just following the guidelines that somebody put out that usually is not a veterinarian who made those decisions. I'm not an anti-vaxxer, but we need to vaccinate appropriately and judiciously. There is not one size fits all. Your dog may have totally different requirements from other dogs that are in that environment. The recommendation for what vaccines your dog gets are going to vary depending on the lifestyle of your pet, and it may vary depending on what the particular group setting requires. But it would be really good to educate yourself so that you can have a conversation with them. If you say, my gosh, I don't want to give my dog 27 vaccines in order to bring him here to have a play session, let's have a conversation about that. This is what my dog needs. This is what I feel, and let's see if we can work around this. First thing that is usually required is going to be the Bordatella vaccine, which is a kennel cough vaccine. So if you're taking your dog to boarding kennel, groomer, dog shows, high pet population events, a lot of times they require this. Now, in an outdoor setting, the chances of your dog getting kennel cough or an upper respiratory virus are much lower than they are in group play in an indoor setting. It's just like when we send our kids to school in the winter. Everybody's crammed inside, the ventilation isn't great, everybody gets sick when the first one sneezes. Kind of see the same thing. In the summer, we don't see very much of that because everybody's playing outside. I personally have never given kennel cough vaccines to my dogs. I don't like them. I don't think it's a great vaccine. Kennel cough can be caused by about 60 different viruses or bacteria, and the vaccine covers 2 to 3 of those, the most common ones. Kennel cough is a treatable disease. Rarely does it develop into anything more than a low-grade fever, a cough, some sniffles, runny nose, and it's like your kid's having a cold. It's not something that is life-threatening. The kennel cough, the Bordatella vaccine, only is good for anywhere from 6 to 12 months. Some veterinary practices and group play situations want you to get it every 6 months. Some are good with every 12 months. Giving the vaccine is not going to guarantee that your pet is not going to get kennel cough because, like I said, there's a lot of different causes of kennel cough that are not included in that vaccine. What you really want is a play area or a boarding grooming area that has really good ventilation, it's really clean, and that they don't require the vaccine. So that is my recommendation. In almost all cases, you're going to be required to have a rabies vaccine because rabies is deadly. If they get it, they die. And if your pet gets rabies and bites someone and that person gets rabies, the chances are that person is also going to die. Rabies vaccines are usually started at around 3 months of age. You get the first one somewhere in that first year of life. It's good for 1 year. The next one that's given, no matter how far out it is a 3-year vaccine. We want to be careful when we're asking for the rabies vaccine for our pets. Try to get a thimerosal-free or T-free vaccine because it is less reactive and less likely to cause cancerous tumors where the injection is given. And it should be given as low as possible on the outside of the right hind leg. So if there is a problem, you can see it, you know where it was given. Because rabies is a vaccine that travels along nerve pathways, be very, very careful if you have a pet with seizure or nervous system disorders if this vaccine has to be given. What are a couple of ways around having to give all these vaccines? Well, one of the things you can do is you can ask for a titer. You can have proof on paper saying that your dog has a positive titer. A titer is a blood test. It measures antibodies in the bloodstream. You can have titers done for distemper, hepatitis, parvovirus, and rabies. If your dog has a protective titer, so there's usually, depending on the lab, it'll either say positive, which means, hey, he's got antibodies, he's protected, or negative, well, we couldn't find any, we don't really know. And the reason we don't really know is because we cannot measure memory cells in the body, which is a different form of immunity. So your pet may actually have immunity, but we can't measure that. So the only thing we can do is that antibody measurement in the bloodstream. If your pet has a positive titer, then you could take that to the group play situation, boarding, grooming, whatever it is, and say, well, look, I have a titer that says he's got antibodies to this, he's protected, we don't have anything to worry about. Not all boarding, grooming, daycare facilities will accept a titer. This is where we have to do a better job educating the owners of those facilities, getting them to understand what a titer is, and that a positive titer means that the dog has protection and is okay to be in that environment. Another way we can get around having to give the vaccines is to give something called Nosodes. Nosodes are basically homeopathic remedies. It's made from some of the disease product, like saliva from a rabid dog, or in the case of parvo, bloody diarrhea from a dog with parvo, and they're made by a series of dilutions. So you start with that little bit of saliva or that little bit of bloody diarrhea that has the virus in it, and then it's diluted many times over, so that we're basically left with the energetic portion. Homeopathy basically is like treats like, so we use that in food therapy as well. That's really how a vaccine works. Like treats like. In order for your dog to build antibodies to parvo, we give a modified live parvovirus vaccine. So it actually has parvovirus in the vaccine, but it's been modified so it does not cause the disease. It causes the body to make antibodies against the disease. So Nosodes really work the same way. They can be used, you can give Nosodes for distemper, parvo, rabies, and then you can run titers to see whether your pet developed protection against the particular disease. So that's another way to do it. Nosodes can also be useful if there is an outbreak of parvo or distemper or kennel cough to help mitigate the symptoms of the disease after an infection has been contracted. At this point, there is no scientific evidence that Nosodes are just as effective as vaccines, but I have had clients tell me that they have not vaccinated their dogs, they've given Nosodes, and then when they do the titers, they end up with incredibly high titers, showing that they're protected. I am not trained in homeopathy. If you want more trusted information on the topic, I would suggest researching Dr. Will Falconer. He has great information. He's a great homeopath, and he has a course called Nosodes, Titers, and Titers, Smart Strategies to Avoid Vaccine Injury. This vaccine information and a lot more is available in my book that just came out, Naturally Healthy Pets Unleashed, which contains my recommended vaccination protocol, homeopathic vaccine remedies, and more vaccine detox recommendations. And it also has a lot of information on how to be a good participant with your dog in group play and how to find a good group play environment for your dog.